we are back with Cone Health, and we're talking about your wellness checkups in this 2-year well-being. And we're talking about the prevalence of heart disease. And this is, of course, is Heart Disease Awareness Month. Why should it be a priority for all of us to be paying attention to it, especially if we don't have family history?
Right. Well, heart disease is something that claims the lives of near 700,000 Americans every single year. Frankly, it's one of the more prevalent, chronic conditions, and it's a huge impact on quality of life. And certainly, it's one of those things that you take care of your blood pressure and your cholesterol early on, and maybe it's not something that you'll face later on. It's risk factors are always changing. It's always important to keep an eye on those metrics early on to prevent any adverse events later on.
All right, let's talk a bit of the prevention strategies for warding off heart disease. First and foremost is eating a healthy diet, and that looks like?
A lot of different things are considered a healthy diet. Certainly, in this day and age, you can hop on the internet and find just about any kind of diet can be healthy. In general, my recommendations are limiting processed foods, are controlling portion sizes, and eating mostly plants, fruits, veggies, nuts, seeds, legumes. If you have a pretty colorful dinner plate, you're probably going to get a wide variety of nutrients, and if you have plenty of fiber in your diet, going to do great things for your cholesterol and your blood sugars.
Yes, if everything is just like that shade of pale, not quite white or something like that, you're talking about that is not what we're looking for.
Not exactly. No, the typical meat and potatoes diet, unfortunately, as much as it is a standard for a reason, is not necessarily the reliable diet for heart health.
Okay, so and then being physically active, and people always want to know, okay, well, how physically active do I actually have to be?
So the American Heart Association recommends about 30 minutes of exercise 5 days a week at a minimum. So 150 minutes of exercise total. Exercise, well, what is exercise? Is it running? Is it lifting? No, exercise can be anything that gets your body moving, that gets your heart beating a little bit faster than it is at rest. What I always recommend to patients is find exercise that you enjoy. If you don't like running, don't run. Do yoga, swimming, you can walk, you can find something that gets your body moving, that you enjoy it, that you'll keep coming back to over and over again to stay active and maintain those healthy habits.
Okay, and then one of the big things, of course, is to stop smoking. And does this include vaping and all other kinds of tobacco products like dipping and things of that nature?
In reality, the only thing that should be going into your lungs is fresh, clean air. Anything else is going to be sort of an insult to that tissue and risk damaging those lungs. Of course, these vape pens and e-cigarettes are new, certainly a lot newer than traditional tobacco products like cigarettes and cigars. And so we don't really have a lot of long-term data on those. But what we've seen so far is that while they may be better than cigarettes, they're really not all that great for you.
Okay. What age should we start thinking about heart health and making these steps a priority? Because we think, over the age of 50 maybe, or over the age of 60.
I start screening for cholesterol, for blood pressure, and really keeping a close eye on those things for patients in their early 20s. It's really once somebody's reached adulthood, that's when I start to get concerned that this might be something that starts catching up to them. Especially with folks who might not know their entire family history. They might know, well, my grandfather had a heart attack, and I don't know how old he was. It was before I was born. Well, that could have been in his 40s or in his 50s, and that's something that we really want to take steps to prevent starting in patients' 20s.
All right, because people will say, well, I can't change my history, my medical history, and what my family had or whatever else. So why does it help that much? And that is just so that we can do some preventative things.
Exactly. There's never been a better time through all of human history to be sick or to need any medical attention than there is right now. We have so many options for therapies, both medical and otherwise, that can help prevent these adverse health events.
All right, and so what types of family history would be good to know? I mean, obviously, if someone had a stroke or a heart attack, but are there other things?
Sure. Any high cholesterol, certainly any high blood pressure, any early deaths, unexpected deaths in the family history, certainly looking for a history of cancers. And while not all cancers are genetic, there are a fair few and certainly trends that we want to establish. And, any other relevant family medical history is really something that we can draw on if we need to, depending on how a patient's presenting and what concerns we have going forward.
Okay, and one last thing. We just had this discussion at work not too long ago about eye exams. And someone said, well, my eyes are fine. Why do I need to go get an eye exam?
Well, certainly eye exams more than just your vision. We want to make sure the pressure in your eyes is okay. Glaucoma can claim your vision pretty quickly if we don't look out for it. Beyond that, not a lot that we like to, delay as far as age-related changes. Uh, hey, I know my dentist would be dismayed if I didn't mention a regular dental cleaning every six
Right.
months. Nobody
Okay.
likes it, but it's got to get done.
Good to know. All the wellness checks. All right. You can find all of this information in the To Your Wellbeing section.